Choking occurs when a foreign object lodges in the throat or windpipe, blocking the flow of air. Adults often get choked due to a piece of food, while children often swallow small objects. Because choking blocks oxygen flow to the brain, first aid is very important to save the victim's life. This video presents how to save someone or yourself from choking. The universal sign for choking is hands clutched to the throat. If the person doesn't give the signal, look for these indicators: inability to talk, difficulty breathing or noisy breathing, squeaking sounds when trying to breathe, cough which may either be weak or forceful, skin, lips, and nails turning blue or dusky, skin that is flushed then turns pale or bluish in color, loss of consciousness. In case the person can cough forcefully, let them keep coughing. If the person is choking and can't talk, cry, or laugh forcefully, apply the 5 and 5 approach recommended by the American Red Cross to delivering first aid. Give 5 back blows. Stand to the side and just behind a choking adult. For a child, kneel down behind. Place one arm across the person's chest for support. Bend the person over at the waist so that the upper body is parallel to the ground. Deliver 5 separate back blows between the person's shoulder blades with the heel of your hand. Give 5 abdominal thrusts. Perform 5 abdominal thrusts, also known as a Heimlich maneuver. Alternate between 5 blows and 5 thrusts until the blockage is dislodged. If the back blow technique doesn't work or you haven't learned it, apply the abdominal thrust procedures as both approaches are acceptable. To perform abdominal thrusts, Heimlich maneuver, on someone else, stand behind the person. Place one foot slightly in front of the other for balance. Wrap your arms around the waist. Tip the person forward slightly. If a child is choking, kneel behind the child. Make a fist with one hand. Position it slightly above the person's navel. Grasp the fist with the other hand. Press hard into the abdomen with a quick upward thrust, as if trying to lift the person. Perform between 6 and 10 abdominal thrusts until the blockage is dislodged. If you're the only rescuer, perform back blows and abdominal thrusts before calling 911 or your local emergency number for help. If another person is available, have that person call for help while you perform first aid. If the person becomes unconscious, perform standard cardiopulmonary resuscitation, CPR, with chest compressions and rescue breaths. To perform abdominal thrusts, Heimlich maneuver on yourself. First, if you're alone and choking, call 911 or your local emergency number immediately. Then, although you'll be unable to effectively deliver back blows to yourself, you can still perform abdominal thrusts to dislodge the item. Place a fist slightly above your navel. Grasp your fist with the other hand and bend over a hard surface, a countertop or chair will do. Shove your fist inward and upward. To clear the airway of a pregnant woman or obese person, position your hands a little bit higher than a normal Heimlich maneuver, just above the joining of the lower ribs. Proceed as with the Heimlich maneuver, pressing hard into the chest with a quick thrust. Repeat until the food or other blockage is dislodged. If the person becomes unconscious, follow the next steps. To clear the airway of an unconscious person, lower the person on his or her back onto the floor, arms to the side. Clear the airway. If a blockage is visible at the back of the throat or high in the throat, reach your finger into the mouth and sweep out the cause of the blockage. Don't try to finger sweep if you can't see the object. Be careful not to push the food or object deeper into the airway, which can happen easily in young children. Begin CPR if the object remains lodged and the person doesn't respond after you take the above measures. The chest compressions used in CPR may dislodge the object. Remember to recheck the mouth periodically. To clear the airway of a choking infant younger than age 1, assume a seated position and hold the infant face down in your forearm, which is resting on your thigh. Support the infant's head and neck with your hand and place the head lower than the trunk. Thump the infant gently but firmly 5 times in the middle of the back using the heel of your hand. The combination of gravity and the back blow should release the blocked object. Keep your fingers pointed up to avoid hitting the infant in the back of the head. Turn the infant face up on your forearm, resting on your thigh with the head lower than the trunk if the infant still isn't breathing. Use 2 fingers placed at the center of the infant's breastbone. Give 5 quick chest compressions. Press down about 1.5 inches and let the chest rise up again in between each compression. Repeat the back blows and chest thrusts if breathing doesn't resume. Call for emergency medical help. Begin infant CPR if one of these techniques opens the airway but the infant doesn't resume breathing. If the child is older than age 1 and conscious, give abdominal thrusts only. Be careful not to use too much force to avoid damaging ribs or internal organs. To prepare yourself for these situations, learn the Heimlich maneuver and CPR in a certified first aid training course. Complications. Get urgent medical help at an A&E, NHS walk-in center, or GP if they have a persistent coughing after choking. They feel something is still stuck in their throat. Abdominal thrusts can cause serious injuries. A health professional such as your GP or a doctor in A&E should always examine somebody after they have received abdominal thrusts. Have you ever experienced choking? What did you do? Tell us in the comments section below. Thanks for watching. Don't forget to like, share, and subscribe to our channel for more videos of health and nutrition.